Hi everyone, welcome back again to Instagram Live with Intimate Rose. This afternoon I am joined by Holly of the American End of Endo project. She's going to be sharing her story and about how she is working in advocacy to help empower people with endometriosis and to make the journey a little bit smoother, because goodness knows it's not very smooth for most people. Most people with endometriosis, which is 1 in 10 here in the US, take about 10 years to get their diagnosis, which means that they are suffering for prolonged periods of time. They oftentimes are experiencing issues with bowel and bladder, as well as pelvic pain, painful menstrual cycles, and a whole host of other symptoms. I'm 1 in 10, and I'm very passionate about endometriosis, and I'm very excited to be joined by Holly today. So she will be popping in here any moment. If you all have any questions as we're going, please don't hesitate to put them in the chat, and we will get to them. And this will, of course, be recorded so that you can also access it later. Additionally, this morning I went live with Andrea Martin of Andreas Explains It All, and we talked about breakthrough bleeding associated with hormone therapy during menopause. So if you missed that, that is also on the wall, and we talk about what some of the management techniques are. Andrea shared that oftentimes what they will do is wait 6 months to see how the cycle regulates after that, because sometimes bleeding happens as a byproduct of the lining of the endometrium being confused, and so that she'll be patient with her patients, and then usually it does even out. There's Holly. She's coming through now. If you all haven't already checked out her resources on her website, it is the American End of Endo project. And she has a lot of different resources, and she does some amazing things in the advocacy space. Instagram appears to be tripping on itself as it lets her in today. Holly, are you seeing it? It will not send the request. Uh-oh. Okay. I'm inviting you right now. Maybe if you pop out and... there you are.
There we go. There we go.
As soon as we start threatening Instagram.
Oh my goodness. Hi.
Hi, it's so good to see you.
It's so good to see you too. It's been a minute.
We have not seen each other since Endo Summit in March of 2024. So what has this year brought for you with the American End of Endo project?
Some fabulous new volunteers recently, which has been wonderful.
That's amazing.
Yeah. And we're just, golly, where do I even start? We just recently resent out our questionnaires to endo docs, so that they can update their information on our directory. And let's see here, what else? We're working on our updating of endo squad training, which is a pretty exciting thing. And yeah, just a lot of exciting projects that we're just like chipping away at and working on. So yeah, good things.
That's amazing. Let's start with the beginning. Can you tell folks about your work and about yourself?
Sure. So I started Endo Project. It's weird to say this, but it was 7 years ago. And it shocks me that it's already been that long, but it was 8 years ago that I had my endometriosis excised finally by the illustrious Dr. Cook. And and I did really well after that, after having, a failed regular endo surgery before and trying all the meds and everything like that. So finally I found my relief. And finally I was like, why on earth did it take me so damn long to get this info? What is going on here? And so I decided, I was like, I don't want other people to have to face all these giant gaps in care that I faced. This is completely wrong. So let's do something about it. So, like almost exactly 1 year after my surgery, I started Endo Project. And yeah, and now here we are. So, so the whole idea of it is just to bridge gaps. So every single time there's a gap in care, we're like, let's build a bridge. So one of the first things that we did was we started the first ever directory of endo specialists. And for this, they have to do this questionnaire and really prove themselves, like, because as of right now, pretty much anybody can just be like, I'm an endo specialist. And it's like, no, honey, you're not. No, you're just a run-of-the-mill doctor. You're doing the best you can, but no. So we send out this questionnaire that asks them all sorts of questions, and we put the answers on their profile on our website, so people can basically go there and go, okay, I'm going to search within my area, see if there's anybody, and then read what their profile is saying and kind of start to get some information about them, because also, as you know, just to get a consult sometimes is very expensive. So you want to make sure that they could be a good match for you. You want to make sure that they could be capable at doing what you want them to do. So, because they're not created equal, and some of them have strengths in one area and not in another. And so anyway, so that's why we have that questionnaire. So we started with this directory of endo specialists. And something that's on the back burner right now, and I tell you, if I get more volunteers, I want to go all in with this one, is I want to add more pelvic physical therapists who specialize in endometriosis and pelvic pain, because again, not created equal. So that's something that we've kind of had to put on the back burner, but I'd love to resurrect with some more help. Anyway, so then we have, just good information available that's easy to understand. It's not shrouded in a bunch of heavy medical terminology that you may not have the capability of understanding at all, or you might just not want to get through when you don't feel well. So it's just easy to understand info. We started Yellow Ribbon Pages, which is like a crowdfunding platform for people to raise money for their surgeries. We're collecting grant money to be able to gift to somebody for their surgeries. So pretty much every single time, it's like, there's this gap. It's information, it's access, it's affordability, it's whatever it is, there's a gap. We're trying to address those issues. So that's what Endo Project is all about. And that's what we've been doing for 7 years and keep going. So yeah.
An amazing service that you're providing to others, and such a positive to have created out of your own lived experiences.
Thank you. Yeah, it's like I said, it's just, I can't believe it's been this long. And it's neat when I go and I see on the back end of the website, like how many people have actually looked at the doctors, how many people have actually found their physicians through our website. It's moving. Or when I get emails from people being like, I couldn't have done this without you. And one of the coolest things that happened was when I got to meet the first baby that was conceived as a result of someone who got an endo surgery with one of our specialists on our directory, and somebody I had walked through her endo journey who previously was dealing with infertility. Getting to meet that little dude was just like, oh, it doesn't get any better than that.
No, it sure does not.
Yeah.
That's amazing.
Yeah. Uh,
So when someone is coming in and they're searching, they head to your website. Is
mhm.
there a particular place that they should start, or is it self-explanatory, do you feel, once they come in?
I think it's pretty self-explanatory. I mean, we have our little menu and there's all the little drop downs and some stuff I guess I'm finding is harder to find. And so there's certain elements of the different things that we've created that I want to highlight more in the coming months. Or coming up with a plan about how to highlight those things that are kind of a little bit harder to find. Um, One of those things is um, like information that are like basically posters that are in the proper format for you to be able to at home or send to a print shop print off that you can go put up at your school or your
Mhm.
gym or your church or whatever. They're endometriosis awareness posters. Obviously, if people reach out to us and they want our cool brochures or any of our swagger stuff, we'll send them stuff all day long. But if you want it right now and you just want a poster that you can go put up for Endo Awareness Month, that's something that we have on our website. And we're actually going to be building that collection. And we even have one in Spanish. Somebody from Peru was kind enough to translate this Spanish one. So, that's like there's little things like that are just really helpful, but they're not quite as prominently displayed yet. So need to work on that. But I think a lot of it's self-explanatory. I don't know.
That's perfect. And little by little, you find out. We're still learning what's easy to find on our website and what's more challenging too. So I get it entirely.
Yeah.
And you mentioned that you need some help finding pelvic health PTs. What does that look like? You need more pelvic PTs to come forward and self-identify. You need help creating the questionnaire.
So I worked with some pelvic physical therapists who specialize in endo stuff, and they helped me develop a questionnaire. So I have it; it's ready to go. But one of the issues that we were facing was where to put it, how to get those physical therapists to come forward and show yourself and take the questionnaire. And so that was challenging. I mean, we had some volunteers who were reaching out to, I don't remember what association it was, trying to be like, hey, can we please, like, can you just feature us? Like, we're trying to help you. And they were like, well, you can buy ad space. And we're like, yeah, but the thing is that we're not charging you. And this is a directory and we're trying to match make. So maybe no, so there was this whole, so it's just finding these individuals and having them come forward and take our already existing questionnaire and we will pop them on there because heaven knows I want to add more pelvic physical therapists. That's a huge, huge, huge part of this. So yeah, that's another thing that we need to bulk out definitely.
Well, I'm here to help with that. I will get my pelvic health PT and OT colleagues. We will
Yeah.
get movement there. We'll repost it here. We'll get you
Okay.
a good database of strong people that are happy to help.
Oh my goodness, Christmas came early this year. That is wonderful. I'm so excited. So
That's wonderful.
yeah.
And then you've also done some work in advocacy in terms of legislation. Isn't that right?
Yes, we did. Yes. Not this last March, but the one before that, myself and some people from Worldwide Endo March and Getting the Better of Endometriosis joined up and we went to DC and we got to talk with different state representatives and we got to talk to a couple senatorial teams and that was really exciting and we're actually planning to go back this year and there's some very exciting things in the works, so planning to go back and do it all over again.
That's amazing. That is such a tremendous help on behalf of all patients to get better funding for research, better insurance coverage of appropriate care and appropriate services,
Yeah,
not just ablation surgery, but the excision surgery.
exactly. Yep, that's the plan. And it's, there's only when you're a 501c3, there are certain things that you can do, certain things you can do, certain amount of time you can spend doing this, blah, blah, blah. So we don't do this like all the time or anything like that. It's just a sometimes thing. But it was neat just being able to just go talk to these people and be like, hey, whenever anything does pop up, whenever you hear this, these are some things you need to be looking for. When people are requesting this funding, make sure that your funding is going in the right direction. One of the things I'm always telling these people, and I stood up as the sore thumb in the room at a screening of Below the Belt. That was awkward, I tell you what, but do the right thing. There's all these people there, it's a panel, and none of them were like actual endo experts. And I'm just like in the crowd, and one of them had said something about the research that was being done somewhere, and they were talking about endometriosis, just Samson's theory, retrograde. And I said, respectfully, I thank you for all you're doing, and you're doing this and this right, and I appreciate that, but something I need to tell you is that when the research dollars do come in, you need to perhaps expand your view of where endometriosis is coming from. Because if you are always using all your research dollars, limited as they are, on, saying that it's just the same exact stuff as inside of the uterus, you're throwing your money away. And you can't be doing that. And so I said it then, and then I was saying it to the people in DC. We don't have dollars being given to research, but when we do, don't be throwing it out the window. Right. Like, your research is not based on the wrong suppositions. So yeah, it was good to be able to go and tell these people that, and take notes. Yeah.
That's really important. So for those who are not aware, Samson's theory refers to retrograde menstruation as a driver of endometriosis, which lots of data has shown that is not that is not indeed the driver of endometriosis. And endometriosis is the presence of endometrium similar cells found all over the abdomen, pelvis, into the diaphragm, onto the pericardial sac, around the heart, really all over. So this is not even just a gynecological disease process anymore, though it does have some gynecological symptoms associated with it. It is found on the bowel, it is found on the bladder, it is found on the intestines and everywhere else. So to your point, it's really important that the research is not just all done on the uterus, because that's one very small organ in a very complex multifactorial disease process.
Yep. Exactly. So yeah, gotta tell all these people.
One hand raise at a time. That's really the work, isn't it?
That's exactly well said. One hand raise at a time. Yep. Just saying respectfully, I disagree. Here's the facts. Because there's, as you know, there's so many things, so many different reasons why people stay quiet about the important stuff when it comes to endometriosis and all pelvic health issues, really. There's so many reasons why people just don't say anything. And all of those moments of just not saying something when you really could have is why it's 2024. It's 2024, and we're still having the problems we're having. We're still having the people not knowing anything, and that's why, is because collectively over history we've just constantly been like, I just won't say anything. So yeah, one hand raised at a time. You're absolutely right.
Well, bad.
Mm-hmm.
What else would you like people to know about your work in American End of Endo Project?
What else would I like them to know? I really, really have a lot of good things in the works, and a lot of good ideas, and a lot of, just a lot of wonderful things that are capable of happening. They've been happening, and they're capable of so much more. And it takes a team. It takes a big team, and we're looking for more volunteers. It's really, really important. And something that people might not always be aware of is, we're based in California, but I have volunteers all over the US. So you can really volunteer from anywhere. and we're really flexible with like what you're capable of. You know, as somebody who has dealt with not just endometriosis, but other chronic illness, still dealing with chronic illness. You know, I feel good from endometriosis. You know, I was feeling good for a couple years, then adenomyosis was rearing its ugly head. So then I get that dealt with. And meanwhile, I have something else pop up and I'm just like, oh my word. So as somebody that's been battered by chronic illness, like there is a very gracious kind of atmosphere that we have developed, this gracious culture in Endo Project, where the volunteers kind of in the driver's seat. Like you say, I'm having a flare. It's like, oh my gosh, like go take care of yourself. So you can volunteer remotely. You can have a lot of grace. You can make your own schedule. Say, oh, I can do this much now or this much later or whatever. Pick your own projects. There's, you know, everybody's got gifts and talents that they can give back to the cause. It takes everybody. And so in order to see all these really wonderful things happen, I really hope that we can get more volunteers. Like I said recently, you've got some really, really solid help coming in, and I'm so, so grateful. But I mean, let's keep it going. That's just a really big thing. So
amazing. Well, hopefully this awareness will continue to spread. I'm certainly going to share with our community here that you are in need of more volunteers, both on the patient side and pelvic health PT and OT, so that we can get you that database. And I cannot wait to see what 2025 brings for you and for this project.
Thank you so much. And thank you for all you do. You're just amazing. It's just like every time I talk to a pelvic physical therapist and like I'm like, oh, you familiar with Intimate Rose? Or I see their stuff on the shelf or whatever. Like that's because that's my current pelvic physical therapist. That's her line that she carries. And everyone's like, oh, Amanda Olson. Like, you are so well loved, and I can totally see why, because I adore you. So just really thank you for hosting me today and for just everything you do. You're amazing.
Thank you, Holly. I appreciate that so much. I really do. You made my day.
Oh, yay! You made my day. So we're even.
No. Well, thank you so much for your time, for your expertise and all that you do. Thank you for coming on. We're going to share this far and wide, and I look forward to seeing you again very soon.
Sounds good. Thank you so much.
Thank you, Holly. Bye.